So why talk about serotonin syndrome? This is a very important topic because with more drug use on the rise and just more products on the rise and even prescription meds on the rise, serotonin syndrome can potentially be a higher risk for some individuals. Now, real quick, what is serotonin syndrome right here? Serotonin syndrome, let's first start here. It controls your mood. Now, the average person, it's going to help with their waking and sleep cycle. It's going to help your sleep. It helps balance with melatonin as well. And obviously, if you have normal serotonin levels, your depression in particular, having depression, you have a lot lower chance. If you have a lower level of serotonin, higher chance of having mood disorders and major depressive disorder and even anxiety. Now, real quick, as stated right here, serotonin syndrome typically occurs when increasing an SSRI and SNRI. You might say, well, what's serotonin syndrome? That's when there's an increase in serotonin at a very quick rate. So, for example, as stated, why covering this with meds, with street drugs, and also not knowing exactly how serotonin affects the brain in some ways. Let me put it this way real quick. Serotonin, norepinephrine, and dopamine. In your brain, it's kind of like an intersection. So we have ideas on how these medications work that affect your dopamine, norepinephrine, serotonin, which are your brain chemicals, but sometimes we don't know exactly how they work, so a med you think might be affecting your dopamine or norepinephrine can actually have effects on your serotonin as well. Same with even SSRIs. There's no brain scans or even exact ways to tell if your serotonin's being affected. It could be affecting your norepinephrine or your dopamine, but we have seen that there are a lot of meds that do inadvertently affect your serotonin. For example, even things such as Zofran, an allergy med. But let's go back to serotonin syndrome. So it typically occurs when increasing an SSRI or even an SNRI. Also, something to note, migraine medications such as Imitrex also can increase your serotonin. Now, something interesting to note before I go any further real quick is a lot of times, if somebody starts, for example, an antidepressant, an SSRI, there can be some side effects from it. For example, headaches, migraines, nausea. So you take something to prevent that side effect. And what can happen is you're already getting something that affects your low serotonin level, and theoretically, you take something else, and that can affect your serotonin level, which raising it can cause serotonin syndrome. Also, so migraine meds, anything that ends in the TANs, the triptan families. Now, tramadol is another one, interestingly enough. An increased dose can also cause serotonin syndrome. And this is a good example of what I'm talking about. Tramadol is a pain med, but also can affect, and it can help with depression. It can affect your norepinephrine as well, but also it can cause serotonin syndrome. That's what I'm talking about. Meds that sometimes affect your norepinephrine as well can inadvertently affect your serotonin syndrome. So anytime, the gist of this is anytime you're starting a new medication, you're taking something else with it, if you notice what we're going to be going over in a few minutes, in a little bit, if you notice any changes in behavior, any side effects that come on quickly, you potentially could have serotonin syndrome. But the good thing is, if you recognize it quickly, there's mild symptoms to severe symptoms. Now, real quick, signs and symptoms. Anxiety, restlessness. I underline these ones. Agitation is huge. Now, that would be more so, when I'm talking agitation, it can have moderate, but I'm talking agitation. There's a moderate to a extreme, but agitation is key. Hyperthermia, meaning increased temperature. Ocular clonus, which essentially just means your eyes cannot focus. It's like shaky, kind of feels like the wobbly to an extent. which is also abnormal eye movement, and also GI disturbances, primarily diarrhea. Now, it can be constipation as well. It can be. But these are some of the primary symptoms. Now, as just stated, if you have a rapid onset right here, it can occur as early as 30 minutes to an hour after starting the new medication or taking multiple meds at once, or in more severe cases, if somebody tries to overdose, let's just say on an SSRI, that can happen, but it can happen also 24 hours after. And with SSRIs, and this would be, for example, not on an overdose, that would happen quickly, but let's say you've upped your, let's just throw out Zoloft or Prozac. Let's say you up it, you go in and they up it 20 milligrams because you don't really think it's doing anything for you, right? Though they stay in your system a little bit longer. So sometimes you won't see the effect of it when you've upped your dose up to a week afterwards. But also, if you start noticing these effects, serotonin syndrome should be addressed, because you should address this because it takes a long time to also get out of your system. There's longer half-lives with some of these SSRIs. So 24 hours, even 84 hours with the onset and even getting it out of your system. Now, if you can't go to the ER and you notice it, and once again, if there's a rapid onset, you need to get help. But if you notice moderate symptoms or mild symptoms, which really with mild symptoms, mild anxiety, even shakiness, in other words, you just feel off, but not to the point of where you have a high temperature, you're freaking out, you're almost in a psychotic state, your muscles are tensing up, you feel like you've got no control over those. No, I'm talking just moderate symptoms. First and foremost, remove the medication. Remove. So if you've upped your medication, if it's been, for example, if you've upped the dose, a big thing with this is call your provider, but also go back to your normal dose you were on. Also, if you have started a new medication with, let's just say, an SSRI. Let's say, for example, you're taking, once again, Prozac, and you have nausea, or you have let's not use nausea. Let's say you have migraines and you're taking something for it. Remove that medication. So if you're taking, for example, Prozac, and then you're taking Imitrex with it, and you've just started Imitrex with it, with your Prozac, remove that. Remove the medication, or any new meds in that regard. Now, also, if you're in the hospital and you got to go in, I'll go over some of the treatments. And before I say any of the treatments, there's no single way that they actually test or diagnose for it. But if you do go in, they'll give you things such as Ativan or Valium, which will help relax the person. It'll reduce agitation. It'll also, when it comes to that, reduce the muscle rigidity, the muscle tension as well. And with severe cases, there is Periactin, which they will give either PO or IM, and they'll give over every hour, they'll raise it by 5 to 10 milligrams. But if it's really severe, they'll go IV route. Now, real quick, why once again cover this? And I know there's a lot, it looks like chicken scratch on here, but this is just the way I think, being a psychiatric RN. Why cover this or consider it? So once again, with more antidepressants in particular prescribed, or even more medications which are great, that we have access to all these medications that we're discovering and whatnot. Again, a lot of them, there's no way we can see if it's affecting your serotonin, but a lot of times meds can affect your serotonin levels, which once again, if they increase your serotonin when you combine meds, and this is primarily who I'm talking to, once again, you can, if you try to overdose, obviously, you're taking high doses, but in particular, once again, if you're on medications and you're starting new ones to watch out for it. For example, Zofran combined with other medications, which is just for nausea, can cause serotonin syndrome, which I've seen before. I've actually had in the past a couple of patients who can't take Zofran because they take an SSRI or an SNRI with as well, because it can cause moderate to severe symptoms in regards to serotonin syndrome. And sometimes they will take Zofran with it for nausea, and they won't notice the serotonin syndrome, because it's so mild at first for a while, and then once they're noticing it and it gets to the point where it's unbearable, they've moved from mild to moderate to potentially severe. Also, with it, the signs and symptoms as stated with SSRIs, nausea, vomiting, GI discomfort, so on and so forth, are side effects that can happen. So if you start new meds, or even if you have headaches and you're taking an SSRI, they might prescribe something for headaches, migraine meds. Another chance, it increases the chance. Now, as well, I put a couple other things on here. As I said, there's no single test to diagnose for serotonin syndrome, but also there are other medication classes. Once again, we have antipsychotics can cause it. Also, severe alcohol withdrawal. Someone who's using polysubstance abuse can cause serotonin syndrome. Also, trying to overdose can cause it. Now, also, as stated, SSRIs are in your system for a long time. And I put this here, once again, if you're taking something, and once again, besides even SSRIs, let's go over this real quick. Over-the-counter meds, you have St. John's wort, mixing uppers and downers together. A stimulant with a downer can cause it. Also, as well with this, street drugs, mixing really anything, and this can even be something as simple as, let's say you're smoking cannabis as well. Smoking cannabis and you're taking a prescription. Depending on your genetic makeup and your brain chemical history, this can cause serotonin syndrome. And once again, the key with serotonin syndrome as well is in severe cases as well, seizures can happen. So if you have a seizure disorder, so let's say you have a history of seizures, we talked about in the other video with benzos and alcohol. If you have a history of seizures and you're already taking something for seizures, a lot of times, not even that you're taking an antidepressant or something, if you're taking a seizure medication and you're taking a nausea medication, or you're taking a seizure medication with an antipsychotic, because sometimes antipsychotics are used to treat migraines, which I'm not a big fan of, but can happen. Serotonin syndrome can happen. And the biggest key with serotonin syndrome, again, is what I've said before is this. There's a difference between having signs and symptoms from a medication, for example, just like a minor headache that goes, but if you notice a side effect that is prolonged and not going away, like agitation, and I'm talking like irritability that you just can't kick, you're not sleeping well as a result, this can be a potential red flag for serotonin syndrome. And just real quick to summarize on this real quick on this, always remember, serotonin is something that everyone has in their brain. We have norepinephrine as well. We have dopamine, the pleasure system. All of these brain chemicals in your brain, I'm just going to say this, we don't know exactly how they affect those receptor sites, but this is one thing we can say for sure. Serotonin, norepinephrine, dopamine, these all work together and play a part together. So, and it's kind of like at an intersection, you don't, sometimes let's say you're treating something to increase your norepinephrine or dopamine. That can indirectly play a part on your serotonin levels, which can raise that as well, because we can't specifically test to check your serotonin, norepinephrine, or dopamine levels in the brain. But we do know that they work together. So with time of starting any new meds, be on the lookout. Once again, if you get anything out of this, prolonged symptoms such as anxiety, restlessness, I would say agitation, that abnormal eye movement as well, which you should report to your doctor, diarrhea, or even sometimes some constipation, any GI changes in particular, be on the lookout for. And if you notice these and you've just started a new medication, there could be a chance you have developed serotonin syndrome. That is your daily dose of mental health. Please like and subscribe to the channel. I tell you this just because I don't want anyone to ever go through this. I've seen people go through this. It's something that's not fun, because once again, if you develop it and you just develop this from taking a new medication that your doctor's prescribed, by the time you notice these side effects and symptoms, it can really affect your life and your job if you have one, because once again, a lot of these meds have long out half-lives, and once you've developed it, you can take that med away, and these symptoms can go on for even, I've seen 2 weeks to 2 months at a time. So that's your video. Next video, we will be covering DTs, delirium tremens from alcohol. But that is your daily dose of mental health. Like and subscribe. Leave a comment if you've ever had serotonin syndrome, or if you have any questions about it in general, because there are so many different drug classes that it can cause it. And in particular, pretty much, if you're taking any not every med, but a lot of a medication, really any medication, and you're starting something else with it, any med, even, for example, even a blood pressure medication and a nausea medication, there is a chance you could potentially develop this. That is your daily dose of mental health. We'll have a new video out soon. Thank you for all the support. I really do appreciate it. If you want to be a member of the channel, check that out. Also, I put some other links as well at my homepage. Check those out. I love you all.